Welcome again to Nurse on the Go video. Today we're looking at removal of an IV cannula, a peripheral IV cannula. So we'll have a look at the cannula. Before you remove it, just explain to the patient saying, now Nick, I'm just going to take off this dressing and remove your cannula. It might feel like you're being waxed because it's been on there so tight, alright? And also look, when you remove the cannula, it's a good time to check to make sure again that there's no pus, that there's no cord-like veins, so to check in for phlebitis, no redness around the area, and other signs of infection. So we want to make sure we keep on top of that. To remove it, just peel off the dressing slowly. With the left hand, anchor the cannula, because don't forget that's in a blood vessel and it is irritating to the patient. So keep it all still. Pull off the dressing, discard that. Now before we pull the cannula out, get a bit of gauze, put it over this entry site, okay? So, and before you actually occlude the area, pull the cannula out, let a little bit of blood come up, and then occlude it. Now you hold the pressure on for a good minute to make sure that the cannula will have an occlusion there. And then also, if a person has any anticoagulant, say warfarin or aspirin or something like that, you might have to hold on a bit longer, maybe 2-3 minutes. But don't leave them go home or leave the patient until you've established hemostasis. If you haven't, if it's still bleeding, don't say to the patient, oh, just hold that for a minute, you'll be right, because it's your responsibility to make sure that they do stop bleeding. Because the patient might take their finger off, they're not experienced to know what to look for, and they could bleed out into the bed, which wouldn't be a good look. So after a minute, we'll lift up and have a look. Have a look at the site, just make sure that there's no bleeding. And now you can put one of those, you can either put another bit of gauze with a bit of tape over the top of that, or you can put you can put a bit of gauze on, or you can put one of those little magic dots that put pressure on it. So that's all for today from Nurse on the Go video. Hope you enjoyed the presentation, and we'll see you soon. Bye bye.